And I'm gonna start letting people in the Zoom.
Thank you.
Welcome, everyone.
Yep. Yeah, mine on mute. Okay.
Go ahead and if you're coming in, please hit mute. Good afternoon. So good to see so many people here today. We'll get started in just a couple minutes.
I gotta find my.
For everyone coming in, if you could just hit mute, we'll get started in just a couple of minutes.
Okay, this is another one I can just listen into.
Hi, everyone. As you're coming in, welcome. We'll get started in just a few minutes. If you could mute yourselves as you're coming in, that would be great. Okay. Welcome, everyone, to our second town hall in a series focused on the intersections of maternal mortality and the mental health crisis in Illinois. For those of you who are coming in, if you could just hit mute.
Yeah.
Thank you so much. We can hear a couple of you. Thank you. We are launching these town halls in partnership with the Illinois Department of Public Health to address emerging birth equity issues. And we have a great presentation today addressing trauma and building resilience in maternal child health. My name is Andy Baker, Deputy Director of Strategy and Programs at EverThrive Illinois. I use any pronouns, and we're joined by our partners, Madison Hammett and Myra Diaz at Health and Medicine Policy Research Group, who've done extensive work on trauma-informed spaces statewide. They're going to provide an overview on trauma and the impact at the individual and community level, as well as give us some considerations as we work to serve pregnant and postpartum people. And just a reminder for anyone coming in, if you could go ahead and put yourself on mute, that would be great. Just as we move through.
You know what I mean?
All right. Next slide, please. So just a little bit about EverThrive. For more than 30 years, EverThrive has been advancing the health and safety of Illinoisans by supporting access to quality healthcare and providing resources to achieve birth equity. Our aim is to affirm and center the experiences and voices of communities most impacted by injustice to achieve reproductive justice for all people and communities. And you can see our values of reproductive justice, anti-racism, centering the most impacted, and bold action and transformation. And just a quick reminder, if you just came in, to go ahead and mute yourself today. Next slide, please. All right. Just a couple housekeeping things. As I mentioned, please keep yourself muted to reduce background noise. A follow-up email with materials presented today, as well as a recording of the event, will be sent to everyone who participated and registered for the event. We will have a section on Q&A. Please feel free to type questions into the chat box as we go. There will be a Q&A period at the end of the presentation. Next slide, please. So we'll start just with some introductions. Like I said, I'm Andy Baker, and I'll do some introductions for our presenters. We'll have our presentation, a Q&A, a short section on resource sharing, and then wrap up an evaluation at the end. Next slide. A little bit about our presenters today who come from Health and Medicine Policy Research Group. Madison Hammett is the Training and Capacity Building Manager with the Illinois ACEs Response Collaborative, which she joined in 2018 as a policy analyst. As part of her work with the collaborative, Madison leads and develops training programs like this one focused on trauma, trauma-informed policies and practices, and capacity development. She also manages capacity building partnerships to assist organizations develop and integrate trauma-informed and equity-centered frameworks in their policies and programs. Madison earned a master's of public health with concentrations in community health sciences and maternal child health, and a master's of social work with a concentration in community health and urban development from the University of Illinois at Chicago. Just a reminder for those who are coming in, if you could please mute yourself as you come in. And we also have with us today Myra Diaz, who joined Health and Medicine in February 2022 as policy analyst for the Illinois ACEs Response Collaborative. In this role, Myra plays a critical role supporting institutions across Illinois, integrating trauma-informed and healing-centered frameworks into their policies and practices. She holds a master's degree in public health and social work from the University of Illinois at Chicago, with concentrations in community health sciences, and a bachelor's degree in Latino Studies from University of Illinois at Urbana-Champaign. And with that, if you did just come in, just a reminder to put yourself on mute, and I'll go ahead and transition to our presenters. Thank you all so much for being here.
All right, well, let's get started then. Thank you so much, Andy, for that introduction. Good afternoon, everyone. My name is Myra Diaz, and I am joined by my colleague, Madison. We are from the Illinois ACEs Response Collaborative, which is a program of health and medicine policy research group, as was mentioned. So we at the collaborative work to advance trauma-informed transformation in Illinois. And we do this through advocacy, trainings and capacity building, as well as research translation and dissemination. And today we are going to be presenting this training for you on addressing trauma and building resilience in maternal child health. So before we get started, I do have just a quick request for everyone. So we here at the collaborative are working with a group of evaluators to measure how well our trainings are building awareness on trauma-informed practice. And so in order to do that, we are asking all of our attendees to please complete a pre-survey. If as you notice on the slide here, I have a QR code. If you scan that QR code, it will take you to the pre-survey. But if for some reason you're having trouble with it or any tech issues, we're also going to drop the link to the survey in the chat so you can access it that way as well. You'll also get a follow-up email after today's training with a post-survey link. So if you could also fill that out for us, that would be super helpful. It's going to help us just, to improve our trainings and make sure that we're supporting organizations in the best way possible. Sorry, that was my dog you just heard. All right, so now I just want to make a quick note on the language and content that you'll hear throughout today's presentation. So in this training, you'll hear us repeatedly using the terms trauma, resilience, and other terms. And this is just because these are the words that are typically found the most in the literature on trauma. However, we know that this language may not resonate with everyone. So if you prefer to think about the ideas you're listening to using other terms, that is completely okay with us. We mainly just want you to walk away from this training with an understanding of the bigger concepts as opposed to any specific terminology. Also, since this training is on trauma, we are going to briefly touch upon topics such as child abuse, violence, racism, and other topics that can be heavy for some folks. So we definitely encourage everyone here to take a break if you need to at any point, or do whatever you feel is necessary in order to take care of yourselves today. All right, so we are going to kick things off by first defining what trauma is. So we adapt the concept of trauma provided by the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. So trauma is defined as a threatening or harmful physical or emotional experience to self and others, which can overwhelm our ability to cope and also affects our functioning in multiple domains. So we think of trauma as being comprised of 3 different components, as you can see on the graphic on the slide. These are what SAMHSA calls the 3 E's of trauma. And so looking at the first component, which is the event. So this refers to the actual traumatic event that has taken place. This can be something like a discrete event, such as a car accident or a gunshot injury. It can also be a series of repeated events. For instance, something like community violence or intimate partner violence, or it can even be an exposure to a systemic level trauma, something like structural racism and other inequities. The second E is the experience. So this is what is actually happening to our bodies during all of this. And this can include any markers of high stress, for instance, an elevated heart rate, anxiety, nausea, etc. And then the third component is the effects. So these include any short-term and long-term effects to our health, including outcomes related to our physical health, psychological health, behavioral behaviors that we adopt, etc. So these are all of those long-term and short-term outcomes of the trauma. And so these 3 components are not necessarily linear in fashion. It's more of a cyclical process that takes place, meaning that these 3 different E's can be happening all at the same time, or in some cases, they may even be repeated over and over again, especially in cases where there is chronic exposure to trauma. All right, so why is trauma something that we should care about? Well, as we're going to learn a little bit more throughout the presentation, we know that trauma is something that is incredibly common in our society. So chances are that someone you know has experienced trauma, perhaps maybe even you personally have experienced trauma in your own life. And so it's very likely that this is something that is affecting all of us in some way, including the work that we're doing, as well as the folks that we interact with at work, including our clients and our fellow colleagues. And we know that when trauma is left unaddressed, it can also have daily and long-term effects on our health and social well-being. But we also know that there is something that all of us can do, no matter what role we are in. All of us have the ability to be able to prevent and mitigate the impact of trauma. And so to that end, it's important to note that just because someone has experienced trauma, it doesn't mean that they're now destined to experience adverse health outcomes. We know that when people and organizations commit to implementing trauma-informed policies and practices, that this can make a huge difference in reducing those negative consequences and promote healing. And so this is something that we hope that you'll keep in mind as you're listening to the information throughout this training. All right, so now I want to dive a little bit deeper into some of the types of trauma that individuals may be exposed to, as well as how trauma is part of this larger public health issue with deep systemic roots. So as you may have noticed in the definition of trauma that I gave, it's a very broad definition. And the reason for that is that we know that trauma can encompass a wide range of experiences, from the individual all the way to the systemic level, right? And we know that all of these levels of experiences inform each other. So we like to use this tree analogy to kind of help us build this more holistic and expanded understanding of trauma. And so if you take a look at the image, you can see that we have the top of the tree, which are the leaves, which are currently labeled as adverse childhood experiences, also known as ACEs. These are traumas that occur in childhood, but the leaves of our tree can also represent any individual level experience at any point in the life course. So these would include things such as intimate partner violence, sexual abuse, incarceration, and any other individual level experience. And these are the types of trauma that are typically immediately visible, they're easy to identify. And usually a go-to solution might be to just pluck off one of the leaves and, kind of leave it at that. But we know that those leaves don't grow on their own, right? When we take a look beneath the surface at the roots of our tree, we see that there are adverse conditions happening in people's environments. Things like economic and housing inequities, lack of access to healthcare, community violence. These are also sources of trauma, and these are the types of things that make people's environments a lot more precarious. They can increase the risk for those individual and interpersonal traumas. And they also deprive people of the resources that they need in order to reduce the impact of such traumas. And so as we look even deeper past the roots and examine the contents of the soil on which our tree is planted on, we also see that there are historical and current collective traumas, things like slavery, mass incarceration, and others that have led to these inequities in our systems and policies that continue to impact communities even in the present day. So as we're thinking about how to best support pregnant patients, it is very imperative that we take an approach that puts this entire tree into context, and how all of these different experiences collectively may be impacting a person's ability to carry out the healthiest pregnancy possible. And by simply expanding our view of trauma, we can then begin to move towards solutions that are a lot more holistic. And we're going to talk more about what those solutions can look like a little bit later on. All right, so now let's take a look at how trauma is connected to our health and social well-being. So much about what we know about how trauma impacts our health comes from the Adverse Childhood Experiences Study. So this was a landmark study that was conducted by the CDC and the managed healthcare organization called Kaiser Permanente. The study took place back in the mid-1990s. And this was a landmark study that revealed a lot about how trauma in early life can continue to affect individuals even decades later. So in this study, the researchers surveyed about 17,000 adults in California, and they asked them various questions about early adversity and their current health status. And so there were 3 key groundbreaking findings that came out of this study. The first one is that trauma is highly prevalent in the population. So within the study participant population specifically, there were about 60% of the participants reported 1 or more ACEs. And we've seen that these statistics are similar across the country. For example, here in Illinois, that number is about 70% of adults report that they experienced at least 1 ACE in their childhood. The second key finding of the study is that as the number of ACEs increases, so does the likelihood of having certain health and social impacts later. So this includes adopting certain behaviors such as smoking, poor diet. It also includes chronic health conditions like cancer, diabetes, asthma, and social outcomes like unemployment and educational attainment challenges. And then thirdly, not only can trauma lead to these concerning health and social challenges, but perhaps even more alarmingly, they also increase the risk for a significant reduction in the lifespan. So much so that those study participants who reported that they had 6 or more ACEs in their childhood had a shortened lifespan of up to 20 years compared to those who did not have any ACEs at all. So taking these 3 findings into consideration, it really just goes to show the toll and cost to our communities and our society when we do not take the necessary action to buffer against the effects of trauma. And this is also true of staff. So sometimes, unfortunately, the places that we work in can sometimes also be sources of trauma for individuals. Particularly, we see this within the healthcare and social service fields. So as I mentioned earlier, trauma is not just something that affects our clients, right? It can also affect us as professionals. And one way that can show up is through secondary trauma. So secondary trauma is a trauma that arises when an individual hears about or witnesses the traumatic experience of another person. It can also show up as compassion fatigue. So this is something that emerges when a person absorbs a lot of the emotional pain and trauma of another person through the work that they're doing. And it can often lead to a reduced ability for the staff person to empathize with others. And this is particularly the case when the staff member doesn't have enough supports or resources in place to be able to buffer against these effects. And another issue of concern is this issue of burnout in the workforce. So we define burnout as a state of physical and mental exhaustion related to the workplace. So burnout is something that develops over time. It's not always necessarily linked to being exposed to trauma in the workplace. However, it does become a concern when a staff member feels very overwhelmed by the work that they're doing, and they don't have enough, not enough supports or resources in place provided by their organization to be able to combat against this. So all of these three issues are very common in the health and social service workforce. We have seen that a lot, especially during the COVID-19 pandemic. So again, trauma is not just something that we need to be concerned about when it comes to our clients, but also when it comes to how it impacts everyone in the system, including staff members. All right, so how does all of this impact maternal child health and pregnant patients specifically? So as we learned, the research evidence shows us that ACEs and trauma are strongly linked to a wide range of health issues. So given this and the fact that maternal morbidity and mortality rates in the US are already a lot higher than in our peer countries, this makes pregnant individuals who have experienced trauma especially at risk for some of those adverse pregnancy outcomes. So this could include anything from preterm birth to preeclampsia and other consequences during labor and in the postpartum period. We also know that whatever affects the parent is going to have an impact on the baby, right? So the research shows us that infants of parents who have been exposed to trauma also experience those adverse impacts of that trauma. And these could include consequences such as sleep and feeding difficulties, as well as developmental challenges. A lot of patients that receive our services are also dealing with constant exposure to those adverse community conditions and systemic trauma. So those roots and soil of our tree that we talked about earlier. And we have, again, a lot of evidence that demonstrates how this affects pregnant populations specifically. So, for example, there was a recent study that came out last year that investigated how structural racism and COVID-19 related stressors, particularly stressors related to job loss, have been linked to some of those same adverse birth outcomes that I mentioned earlier, and infection while pregnant, premature births, underweight or underdeveloped births as well. We also have a lot of research that shows us how racism and discrimination also contribute to a lot of these pregnancy-related consequences for both parent and baby. And so these are just some examples, but I'm sure you yourself may have even witnessed a slew of other examples with your clients, how the current state of our systems and policies affect them and how, how that can have an impact on them being able to carry out a healthy pregnancy and, be able to have the healthiest birth outcomes possible.
Okay. So, sorry, can everyone hear me? Myra, can you hear me?
Yeah, I can hear you.
Okay, great. So Myra has walked us through these different types of trauma and how the effects of that traumatic stress can manifest in really very real health outcomes for pregnant people. But what they all have in common is they are different types of traumatic stress, right? And so now what we're going to talk about is what's actually happening to our bodies as we experience that stress and what we can do to address and prevent those effects. So I've made Myra give you all of the hard outcomes and statistics, and I get to do the solutions oriented piece. But the first thing we want to remember might seem a little contradictory based on what we're covering, but stress is not inherently a bad thing. In fact, stress is incredibly useful for us and our well-being. Our bodies need it to survive. We have those stress responses because they teach us new things. And so what we need to focus on instead is making sure that that exposure to stress remains healthy. So in general, we talk about 3 types of stress that someone can encounter. The first is positive stress. This is a normal and essential part of healthy development. This everyday stress helps us figure out how to problem solve, how to plan, and provides opportunities for us to figure out new ways to take care of ourselves and to learn new ways to adapt to challenges. So this could be something like getting a shot, getting a vaccine, the first day of school or work. These sort of positive experiences that might make us feel a bit anxious, but ultimately result in a good outcome. The second type of stress is tolerable stress. These are the situations that might feel more intense or last longer, but are ultimately ones that you and your body will eventually recover from. These are situations that, again, might be really hard and might be difficult, like the loss of a loved one or a prolonged illness or injury. These are very difficult situations, but with time, they lead to an ultimate outcome, again, of learning how to self-soothe and take care of yourself, as long as we have the supports we need without impacting our well-being. The final piece, and this is the part that we most associate with the trauma that we've been talking about, is toxic stress. This is excessive or prolonged stressors, that continued activation of our fight, flight, freeze, or fawn response, those 4 Fs, which we'll touch on in our next slide. That constant activation of that stress without any buffering or any protections in place. And these can have really long-term impacts on our health and well-being, particularly if we don't have the protections afforded by stable, responsive, cooperative relationships and care. So these are situations like prolonged abuse, exposure to community violence, including some of those systemic issues like Myra was talking about, as well as, larger, bigger issues like racism, poverty, things that are very much outside of an individual's control. So what do we do about that? Why is it important to know about all of this? Well, it's important to know about what's happening to us biologically, because that helps us figure out how to adapt to that stress. It also helps those of us who are providers or case managers or just community members, coworkers, figure out how we can support people and ourselves when we are experiencing stress and trauma. So I am not a neurologist. I am not a neuroscientist, but I do have a very simple illustration of a brain here that shows us how we have these different levels of learning and adaptation that we need to address to take the best care of ourselves internally. So the first level that we want to think about is, am I safe? That very basic need. So when we are born, what is the first thing that we want a baby to do? We want them to cry, right? We want them to let us know if they are safe, if they are comfortable, if something is wrong with their body. And that's really the most basic primal instinct, is our brain determining, do I have the resources I need to keep my body alive? And so this is that innate instinct around those 4 Fs we talked about earlier: fight, flight, freeze, and fawn. And it's also about how do I get the resources I need to stay safe? So how do I get attention from my caregiver? Well, I cry. How do I, as an adult, get that safety? How do I make sure that I'm getting what I need? And we are, again, hardwired to survive. But if that safety is threatened, then we can't get to that next level of relationship building, or am I loved? And these are those pieces that we start learning, again, the minute we are born. Who's going to take care of me? Who can I trust? Who's going to love me? And as we get older, ideally, these relationships and the idea of what love and respect and care is, those evolve and get more complex and broaden. So this is not just that familial love, which is certainly very important. It's not even just friendship or companionship. It's also love and respect from our coworkers, from the people we interact with on a day-to-day basis. So thinking about if you are patient or client facing, your patients and clients, do they feel loved and respected as human beings when they come into your office, for example? These are an innate instinct, and we know very early on, again, what that feels like. So again, we have to nurture that to get to that next most complex level, because that's what gets going to play a role in helping us determine, am I thinking clearly? This, again, is the most complex types of thinking that we're going to do. So these are the pieces of our day that require conscious thought and effort to complete. This is going to work, completing our tasks, paying bills on time, making appointments that we've scheduled, even more elementary skills that we might take for granted as adults, reading, problem solving. These pieces are all affected by that cognitive those cognitive elements that come into am I thinking clearly? None of that can happen, though, if our core needs of safety and care are not being met. And yes, this is absolutely true of children, and particularly young children, those ages that we tend to focus a lot on, but it's also true throughout the life course. Adults need safety and love and care just as much as children do, particularly pregnant people, because that's two folks that we're taking care of, right? And so that's why it is so important to think about this on multiple levels, because it's all part of, again, that idea of this point that Myra made in the beginning. Trauma, yes, is very common and can have detrimental effects, but we as individuals and organizations can take steps to prevent those further effects in a person's life course from taking hold. So trauma does not equal destiny. You are not doomed to poor health outcomes if you are a survivor of trauma. And we all can work together to prevent harm, both as individuals and in communities, by focusing on elements of resilience building and implementing trauma-informed policies and practices, or TIP. So that's what brings us to resilience. And I know, and we know here at the Collaborative, this is a word that can have a lot of meaning and sometimes baggage for folks. And we actually share some of that baggage. But when we are talking about resilience here, we are simply talking about the process of adapting in the face of adversity and having the supports on how to recover from adversity. So when we say resilience, we don't mean, oh, you're so tough and you don't let anything bother you, or, you know, nothing affects you. So we'll just keep piling on. That's not what we mean. Instead, we mean you have somebody there to support you, whether it be an individual, a community, an organization, whatever that might be, to help you get through the hard times. Not that the hard times don't have an impact on you. And that's, again, when we're going to go back to those 3 E's. So resilience, again, is that nurturing or supportive event, or an environment that we grow up in, or just, you know, live in as an adult. And we experience that just like we experience trauma. Our bodies are learning, and what they're learning is how to self-regulate and soothe. This helps us figure out, this is what I'm supposed to feel like when I'm safe. And we unconsciously seek those feelings out so we can keep feeling safe. So that's why it's important to avoid characterizing some of those safety seeking behaviors as maladaptive, because people work with the resources they're given, right? And so if you feel safe in a situation, you're going to keep seeking that situation out. But if you've grown up in an environment where safety might look very different than what the norm is, that might have a lot of baggage for some folks. So we really encourage the reframing from maladaptive to just simply adaptive. People are experiencing safety within the environments that they're being given. But it's important to try and promote healthy, stable, and loving experiences, because that's what's going to help foster those long-term regulation skills and healing. So again, resilience isn't saying you've never experienced hardship or that you just let everything go by and doesn't bother you, but rather when you've experienced hardship, there was someone there, whether it be a parent, a grandparent, a teacher, a neighbor, someone there to show you what safety and love feels like. And that helps foster those long-term regulation skills and healing. And we carry those throughout our lives well into adulthood. And so the biggest piece in getting from, no resilience or not viewing it through that framework, the biggest piece in getting started and building it is a simple shift of thinking from what's wrong with you to what happened to you. Because when we're confronted with those adaptations that I talked about, a lot of times our instincts as human beings is to say, well, what's wrong with you? Why are you acting this way? You need to show up to your appointments. You need to act like this. What's wrong with you? But what we know is folks are just acting in the ways that they've been taught by their environments, by their communities, by the places they've grown up in. This is what's going to get me through the day. And that sometimes clashes with the environments that they're in now. So that's when we need to shift our perspective to what happened to you. Because when we start asking what happened to you, what we're really getting at is what's right with you. So asking patients, clients, coworkers, what have you been at? What have you been really successful at? Even if it's outside of these walls, what has gotten you to this point successfully? What matters to you? So getting to goals and motivations for being here. How can we utilize that as caretakers, as partners, as patients, as clients, as providers, whatever your role might be? What's important to the folks that are in this room right now? And that really leads us to what can we accomplish together? So determining what shared goals are with our outcomes and with somebody's plan of care or case management, whatever your role might be. Even if you're a manager, what's your staff members' goals? What can you work on together? Because what trauma-informed policies are really about is a sense of shared power and working together to foster a new community. And you do that through the trauma-informed approach. So these are the 4 R's, again, from SAMHSA, Substance Abuse Mental Health Systems Administration. It's quite a title. But when we talk about the 4 R's, what we are talking about is realizing the prevalence of trauma. And so you've all done that because you've come here today, and you'll remember Myra's slide where she told you how prevalent trauma is. But also recognizing how that affects all individuals. So when we say a trauma-informed organization, which is a very, long and living process, that is an organization that recognizes that trauma is affecting everyone within it, from the people that are served by the organization all the way up through the staff to the CEO to the president, whoever it might be. Everyone is impacted by trauma in some sense. And so all policies and practices have to work together to address that. And they have to respond by putting that knowledge into practice. So that might mean changing policies. That might mean changing what you're doing when you're working one-on-one with folks, because what you're really ultimately working towards is this resisting re-traumatization. Very often, folks who come in with a history of trauma are often re-traumatized by the systems that are set up to help them, because they're not taking into account that there are survivors of trauma there, right? And so then if you're being traumatized by a visit to a doctor's office or seeing your social worker or getting your kids to school, how much harder is it going to be for you to continue a relationship with an institution that is bringing up trauma, that is creating trauma often because it's not guided by a culture that is similar to your own or acknowledges your history? So how do we acknowledge that? Well, we utilize what we call here TIP, so trauma-informed policies and principles. And broadly, it's very similar to what SAMHSA says, understanding the pervasive nature of trauma and promoting those environments of healing and recovery. And importantly, I want to preface this before we even get into the details of it. Importantly, TIP is not about providing one-on-one psychological care necessarily. If you are not a mental health provider, we do not expect you to become a mental health provider through this. Rather, it's about thinking about the job that you already have, the work you already do, and how you can provide those services in a way that is accessible to and accepting of those who have experienced trauma. So what this looks like in practice are here, you see our pillars of TIP, and we'll go into detail in the next slide, of establishing safety. And this is both physical and emotional, building trust and transparency, providing choice, practicing collaboration, promoting empowerment, and honoring culture. And this is culture of both the community you are serving and the culture of your organization. So what does this look like? Establishing safety. So considering your physical environment, this could be the seating, the layout of a room that you have, the position of your entrance, how close you're standing next to your patient or client. Also that emotional safety. Do people feel safe telling you their, really hard stories? What can you do to promote that safety and make sure that people do know that they can trust you? And so you build that trust and transparency. This can be, again, sort of setting those baselines of you can talk to me without judgment. It can also be about establishing clear boundaries, setting expectations about communication. An example is you can call the clinic anytime, but I return voicemails between 9 and 5. So it's letting people know what's going to happen, when it's going to happen, and often too, why it's going to happen. This is really important, especially if it is something that, a patient or a client might not have any control over. But when there is an option for control, it's also about providing choice. So providing options when possible. This could be, for example, at the start of a conversation. I have 3 items to talk about, X, Y, and Z. Which one would you like to talk about first? It can also be choices that you may not necessarily agree with often. This can be something like, well, if you show up to meetings, this will be the outcome. And if you don't show up, this will be the outcome. Rather than laying it out as an ultimatum, ensure people that it is their choice. And that is the power that you have that you're able to give them in that moment. And doing that without judgment. And that's about practicing collaboration too, acknowledging others' perspectives and presenting a shared relationship, particularly if you're a patient or client facing, or even a manager talking to a staff member. Often it feels like so much is out of people's control. And so really presenting that relationship as a partnership when it's possible. This is a priority for us. We've previously decided, and checking in too. Does that still work for you? Are these still your goals? And accepting the answers when there may not be the ones that you would choose to. Promoting empowerment. So empowerment's another word like resilience that has a lot of meanings for folks. But when we say empowerment, we mean everyone already has power. It's, are they being given the space to utilize? People are already experts in their own lives and their own stories. So does your organization provide space for them to actually use that power and have it be respected? This can be as simple as offering advice with permission. I have some thoughts on how we can move forward. Is it okay to share them? And having that shared learning. What do you think we should do next? Again, people, you are never going to be as much of an expert in someone's life, excuse me, as they are. And so it's really important to acknowledge that and to give them space, just like you would any other expert on a working team. And finally, honoring culture. So very often patients, clients, folks that, excuse me, patients, clients, folks that are coming into your organization, they're coming in from a culture that is very different from the systems of power that set up the healthcare world, the social service world, the legal world. All of these systems are not set up with the folks that most often utilize them in mind. And so that's why it's really important to allow your patients, your clients, even other coworkers too, to guide around their cultural preferences, pronouns, language, familial relationships. It's really important to ask folks, what else would you like me to know? Excuse me. Myra, can you close us out?
Yeah, no problem. You want to go to the, well, I'll kind of wrap up that last point. So yeah, so like Madison was mentioning, honoring culture and history, right? We know that like Madison said, a lot of times the systems that we work for, right, don't necessarily have those things embedded within their policies to make sure that people feel safe and comfortable, you know, just depending on their own cultural background. And so to kind of wrap up these last couple points, I don't know if Madison, if you're still there, if you can click through the rest of the points, but just to kind of wrap up today's presentation. So as we mentioned, trauma is very common in the population, and it's something that doesn't just affect the communities that we're serving, but it impacts all of us in one way, shape, or form. Right. So this includes us as professionals, as well as the folks that we call our colleagues. As we also mentioned, trauma is not just something that can take place at the individual level, but we know that there are different forms of trauma happening at each of the levels of the ecological spectrum within our community, within our environments, within the systems that we interface with every day. And all of these things collectively impact our health and well-being. But as we mentioned, we also know that there are a lot of things that we can do within our organizations to make sure that we are providing the best support possible to the clients that we're serving. And not just the clients that we're serving, but as we mentioned before, everybody who's involved in the system, from us as professionals, as well as our colleagues. There is something that all of us within our different roles can do to make sure that we're fostering that resilience and we're promoting that, you know, those healing centered practices to make sure that we're not re-traumatizing folks, and you know, that making sure that we're preventing and mitigating those negative health consequences of trauma. And yeah, just like I mentioned, or just like Madison took us through, we have those 6 pillars of trauma-informed policy and practice. I believe we have some additional resources that we can also share out with folks if you want to get a little bit more detailed information on what that can look like in the work that you're doing.
And Myra and Madison, thank you so much for all you've presented on so far. Just wanted to let you know we have about 10 minutes for the activity and Q&A.
Great. This will
Keep
lead
going.
right
Thank
into
you.
our QA. Thank you. And thank you, Myra, for closing us out and letting me deal with my asthma there. But we wanted to hear, and luckily I can now push it back on y'all to do some talking. We wanted to hear from y'all about the work that you are currently doing and how your organization might be currently integrating some of the things we've talked about. And in our next slide, I'll pull those pillars up again for us. So like, where are you already succeeding? Where would you like to grow? What's really resonated here? And then importantly, because this helps us in our work as doing capacity building, but also because I think it helps when lots of folks come together from similar backgrounds, but different organization. What support do you need from leadership? What is it that if you want to implement this trauma-informed work, or if you want to know more about trauma-informed policies, trauma-informed practices, what do you need to establish safety or practice that collaboration with the folks that you work with? Is your organization doing that honoring of culture? And so if you want to put something in the chat, if you want to take yourself off mute, I know we're going to slide right into our Q&A from this too. So if you have questions, Myra and I are both looking at the Q&A. So yeah, is anyone already doing some of the work that we've talked about today, or wants to get started on it and has walked away with some ideas? Or alternatively, does this all sound like a fantasy and really nice, but this isn't going to help me at all because I've got this going on? That's also good to know too. So yeah, well, we've got the chat box open, or you can take yourself off mute. So. Or we can go right into questions too.
Did they say they're gonna answer the questions or?
Oh, did somebody take themselves off mute?
Well, hi, this is Sherry Kaufman, and I'm with the Department of Human Services Better Birth Outcomes Program, and our new nurse supervisor, Sharon Madrigal, is also sitting in with me. And first of all, I do, when you get the recording of this sent out to us, want to share this program with our other nurses and allow them to share with our providers. But I would also like to know if I can possibly.
116 people.
Oh,
Maria?
I'm going to mute.
I think if you aren't asking a question, please mute yourself.
Sorry, Sherry, could you repeat that last part for us?
One of my questions would be, we have a quarterly meeting with our Better Birth Outcomes providers, and our next one's coming up at the end of March. I would like to know if I could get one or both of you to present this material at that meeting.
We definitely do presentations like that. I know Andy's going to send out some materials with our contact information. So yeah, we're more than happy to get in touch with folks if they're interested. Andy, would you like me to stop sharing my screen and we could use your slides for this portion? Would that be helpful?
Yeah, that sounds great.
Okay, great.
It looks like there were a couple questions too in the chat. One from Samsung.
Yeah, I see. So
Okay,
someone
wonderful.
asked, I wanted to know an example of positive stress. I see that an example of toxic stress is abuse and tolerable is death of a loved one. So an example of positive stress are those stressors that we face in our everyday life. Like if you're a student, for example, a test at school, or a deadline at work, a big meeting or a big presentation like this that Myra and I had to plan and prepare for. Something that, you know, might make you feel a little anxious, but ultimately is not going to lead to harm. I think one of the examples we have on the slide is a vaccine, for example. So feels scary maybe in the moment, but we know it will ultimately lead to some good and helps our body learn new positive ways to manage and calm down from that stress.
Also in the chat, Chanel Thomas said, Children's Home and Aid, I'm a home visitor. And this helps me better understand what families may be going through so that I can better assess their needs. And then Amanda Mitchell also had a question. How do you promote empowerment with people that are afraid to speak up?
Yeah, I think that's a great question because empowerment's such a sticky sort of idea, right? This idea like Madison came in and empowered you all right now. Aren't you all so lucky? Myra just gave you all this power. And that's not what we want to promote, that idea. So rather it's this idea that people already have power, right? But what happens is that systems and organizations, perhaps not even consciously, are often set up to work against the power that folks have, right? Because we have a certain way of doing things and that's just how it's always been done. And so when people say, well, actually, this is my experience or this is my idea, it's often pushed back or silenced, right? And so what I think the most important thing that organizations can do is be quiet, for lack of a better phrase, is are you making space and making sure that people feel safe to say, well, actually, no, that's not what I want to do right now. That doesn't work for me. And this is why it doesn't work for me. And this can be really simple. Like, actually, I can't make that appointment because the bus that I take stops running at 8 p.m. and you're going to get me home too late. So I need another appointment time. How is that received? How is it received when people say that's not my experience and that's not going to work for my experience? Is it pushed back against or is it given space? And so really what we need to do is have safety and understanding when we hear things that maybe we don't want to hear and acknowledge like, well, that's what works for you right now. And so we'll work with that.
Great. And we have time for one more short question.
There's one in the chat. Well, there's a statement from Myra that says, I'm worried about all the compassion fatigue that is occurring within healthcare providers. And one last question from Louis Harris Merker. Correct me if I'm wrong when I'm saying that, but how do you repair a relationship that already has been damaged with someone who has experienced trauma?
I think this is very similar to that empowerment question of the person who has experienced trauma. Like we said, they have an adaptation to an environment that has told them, this is what you need to be safe. This is why you need to react this way. It's what keeps you alive. And so if you are in a space where you're not feeling that activation, you're not feeling the trauma in that moment because you feel safe in the current environment, thinking about how you can modify it and your responses to be that safety for folks. So again, that sort of what's wrong with you versus what happened to you, of, what can we do to make this right? And so that does, again, come from that letting others lead, even in situations where that might not be the norm, because it's really, again, about creating that feeling of safety. So if you, for example, have a client or a patient who's like, well, very upset and says like, I'm never going to come back and you've done this and you've really upset me, then it's not saying, well, that's not how we do things here. It's, well, what can we do to make sure that you feel safe coming back or you feel respected the next time you come back, and working within those boundaries rather than setting them up yourself, I think. And I know we're right at time, so I just want to thank everyone, but we're happy to stick around if folks have more questions. And I know Andy's going to share some contact info with you as well. So thank y'all.
Thank you so much, Madison and Myra, for being here with us today and for all of your great questions. Like we said, we'll be sending out resources and a link to the recording today. Before we wrap up, if you could, you can go ahead and advance the slide, but go ahead and complete our survey. We take these really seriously and use the survey results to improve the quality of our programming. So if you could take just a couple of seconds, either today, we'll also include a link to that in the follow-up email. Next slide, please. Just going to go over some additional resources for you all while we're here. Next slide. First, if you are already not familiar with our Ever Thrives Healthy Choices, Healthy Futures Perinatal Education Toolkit, We will be sending out a link to the toolkit. This does include reliable evidence-based tools and resources to support individuals during their reproductive years, and can be a tool used by health and social service providers or community members as well, to make sure that folks have what they need anywhere in their reproductive journey. Next slide. We are doing an evaluation of the toolkit, so if you have a minute to go ahead and access the evaluation and let us know your thoughts, we will use that to improve the toolkit for future, so really appreciate that. Next slide. Also, just wanted to let you know, for anyone who wasn't aware, EverThrive is inviting organizations to participate in the Gathering campaign to address maternal mortality and morbidity in Black communities. This is unique because we did use community voices centered throughout campaign development, and so is really a community-centered campaign. It includes imagery and messages with community members about the importance of primary care, postpartum warning signs, and other information. So you can check that out at thegathering.everthrive.org. Next slide. Like I said, presentation materials will be emailed out to everyone, and there is a brief anonymous survey that we're going to move through quickly, but if you want to drop it in the chat. Next slide. Next slide. Great. And we included our contact information here. Please visit our website for more information. You can also reach out to me if your question didn't get answered today. Thank you all so much for your time, for being with us for the last hour. And you can check out our website for information on our next town hall. Okay. Thanks, everyone.
Andy, really quick, somebody asked if they completed the survey at the beginning of the training, do they have to complete another one?
There is a pre and post survey. And so if you could complete the post surveys to show us what you learned during the session, that would be great. Great question.